Hi, Mr. Devin Jones. Thank you for coming in and seeing us today. It is very important that you listen to the information that we need to provide you about your hypertension. You did let us know that you have had uncontrolled hypertension for a while, that your family history has had hypertension, your mom and your dad, that you work in a stressful environment, that you've gained weight over the past year, which is causing some shortness of breath, and that your eating habits aren't the best. This stuff was very important for us to help educate you on how we can get your blood pressure back under control. There are a few different types of blood pressure, which I wanted to kind of go over with you so you know what they are. There's primary hypertension, which is a prolonged elevation, but there's no identifiable reason of why you have hypertension. With this, you'll gradually see your blood pressure going up over time. What's the definition of high blood pressure is a systolic of 130 or greater, or a diastolic of 80 or greater. Um, Patients who have uncontrolled primary hypertension are at risk for cardiovascular disease, and we'll talk about that a little bit later. Then there's secondary hypertension. This one does have an underlying cause. It's usually from some other organ problem that is causing you to have hypertension. So we would get that organ's dysfunction under control, which then will also help with the hypertension medications that we give for you. Some of the reasons why you could have secondary hypertension would be sleep apnea, renal disease, endocrine disease. If you're taking illicit drugs, those can all contribute. Then we also have complicated hypertension. Complicated hypertension is associated with more like what we call end organ disease. So what would happen is the hypertension is so high that it is causing other organs to have diseases because it's not getting adequate perfusion to those organs, or it's causing some sort of damage because of the high blood pressure. And we do not want to get to this stage. At this point, you will be doing some major damage to your body. So there are a lot of different lifestyle factors that are playing a significant role in your hypertension. The one I want to address today is your weight gain. It looks like you've gained 20 pounds over the last year. This amount of weight can add inflammation to your body, which can affect your arteries and your veins. It also can cause epithelial dysfunction, which is more this kind of the same thing. Not that it's the inflammation that's causing it, but there will be changes in those arteries. And then insulin resistance because of the weight gain can add to those arteries as well and cause complications in that hypertension. So there's a lot of things that gaining weight can do negatively to your arteries. So we do want to try to get on some medications to fix that. And then if we're not careful and we don't get this under control, it is a possibility that you could develop heart failure. And there are two types of heart failure. There's there's left-sided heart failure, which initially usually happens, and then it goes into right-sided heart failure. With left-sided heart failure, if this is a reason for your weight gain, possibly because it's more fluid gain, we would be able to reverse that if we're in the early stages of left-sided heart failure. If that prolongs and we develop into later stages, then it's something that won't be reversed, and it's something that we would have to treat along with your hypertension. So the sooner we can start treating this and getting it under control and get some of these lifestyle changes under control, the better. We can decrease the risk of cardiovascular disease for you. So let's talk about medications now on how we want to treat you.